You wake up at 8 a.m. in the morning and your throat feels scratchy and painful. You have an intense thirst, your head hurts, and you possibly have a fever, yet you still have work to do or some place to be. This isn't the first time this has happened to you, and if you live in the United States, you are one of the 30 to 40 million children and adults who suffer from the same soreness in their throats every year. Yet you always wonder, why you? Today we'll be talking about sore throat, a common painful condition that has millions suffering worldwide. We'll look at what causes sore throat, the signs and symptoms of a sore throat, and how do we treat a sore throat, and what can you do to prevent a sore throat too. So let's begin. First, let's look at how a human throat is from the inside. The human throat consists of a pharynx, epiglottis, and the larynx. The pharynx is connected to the mouth, allowing food and liquid to pass down via the esophagus and allows inhaled air from the nose to enter the lungs. It is the epiglottis which acts like a lid and prevents food or liquid to enter the lungs. The larynx contain the vocal cords and they help you to speak. Hence, it is also known as the voice box. Now that we have looked at the structure of our throat, let's look at what causes a sore throat. Although there are various causes of a sore throat, they can be broadly divided into infectious and non-infectious causes. Infectious causes include bacteria and viruses that can infect your throat. Viruses that can infect your throat are rhinoviruses, which causes common cold, influenza virus, mononucleosis virus, measles, and varicella virus. A number of bacterial infections can also cause a sore throat, the most common being the streptococcus pyogenes, which is caused by the group A streptococcus, and that is known as the strep throat. Now, there are many cases of sore throat which are not caused by any of these pathogens, and these come under the non-infectious causes of sore throat. These can include allergies, especially allergies to pets, molds, dust, and pollen can also cause a sore throat. Sore throat due to irritation with irritants like tobacco smoke or chewing tobacco, drinking excessive alcohol, and eating spicy foods can also irritate your throat. Sore throat can also develop due to a strain in the vocal cords, which can be caused by excessive yelling, talking loudly, or talking for long periods without rest. Gastroesophageal reflux disease, which is a digestive system disorder, can also lead to acid reflux into the vocal cords and the pharynx and can cause a sore throat. Tumors of throat, tongue, or larynx can also lead to a sore throat. Breathing excessively through your mouth can also cause a dry sore throat. Let's look at some of the signs and symptoms of a sore throat. Pain or a scratchy sensation in throat that worsens with swallowing or talking. Difficulty swallowing. Sore, swollen glands in your jaw or neck. White patches or pus on your tonsils. A hoarse or muffled voice. Fever. Runny nose, sneezing, body aches, headaches, nausea, and vomiting. Now let's look at some of the danger signs of sore throat. A sore throat that is severe or lasts longer than a week. Difficulty breathing. Sore throat associated with joint pains. Sore throat associated with earache. If you develop a rash on your skin and a sore throat, it's also a danger sign. If you develop fever higher than 101 degree Fahrenheit during a sore throat, that is also a danger sign. Blood in your saliva, swelling in your neck or face is also a danger sign. Although anyone can get a sore throat, some factors make you more susceptible. These include age. Children and teens are most likely to develop sore throats. Exposure to tobacco smoke. Smoking and secondhand smoke can irritate the throat. Chronic and frequent sinus infections. Bacteria from your nose can irritate your throat or spread infection. Close quarters, viral and bacterial infections spread easily anywhere people gather, whether in childcare centers, classrooms, offices, or airplanes. You are more susceptible to infections in general if your immunity is low. Common causes of lowered immunity include HIV, diabetes, treatment with steroids or chemotherapy drugs. Stress, fatigue, and poor diet also contribute to weakened immunity. Usually, sore throat is a self-diagnosis, but let's look at how sore throat is diagnosed in clinics. The doctor will start with a physical examination that will include the use of a lighted instrument to look at the throat and likely the ears and the nasal passage. Gently palpating or feeling the neck to check for swollen glands, also known as lymph nodes. Listening to your child's breathing with a stethoscope, and in many cases, doctors use a simple test to detect streptococcal bacteria, which is the cause of strep throat. This test is the throat swab. The doctor rubs a sterile swab over the back of the throat to get a sample of secretions and sends the sample to a lab for testing. Sore throat caused by viral infection usually lasts 5 to 7 days and doesn't require medical treatment. To ease pain and fever, many people turn to acetaminophen, Tylenol, or other mild pain relievers. However, if your sore throat is caused by a bacterial infection, your doctor or pediatrician will prescribe antibiotics. Regardless of the cause of your sore throat, there are at-home strategies that will help you to ease you or your child's symptoms. The first one of them is rest. Get good amounts of sleep, rest your voice too. Drink plenty of fluids. Fluids keep the throat moist and prevent dehydration. Avoid caffeine and alcohol, which can dehydrate you. Try comforting foods and beverages like caffeine-free tea or warm water with honey. Gargle with salt water. Add 1 teaspoon of salt to 200 ml warm water and use that for gargling 8 to 10 times. Do it especially before you sleep and you will feel a lot better when you wake up in the morning. Humidify the air around you. You can keep a pan of steaming water in your room or use a traditional room humidifier. Consider lozenges and avoid irritants like smoking. The best way to prevent sore throat is to avoid the germs that cause them and practice good hygiene. Follow these tips and teach your child to do the same. Wash your hands thoroughly and frequently, especially after using the toilet, before eating and after sneezing or coughing. Cough or sneeze into a tissue and throw it away. When necessary, sneeze into your elbow. Use alcohol-based hand sanitizers as an alternative to washing hands when soap and water aren't available. Avoid touching public phones or drinking fountains with your mouth. Regularly clean telephones, TV remotes, and computer keyboards with sanitizing cleanser. When you travel, clean phones and remotes in your hotel room. Avoid close contact with people who are sick. So guys, this was all about the sore throat. Thank you so much for watching. See you in the next one.